Tonight, a new warning about social media and the effects it has on children. Charmaine Nero joins us now with the Surgeon General's warning. Charmaine?
Yeah, Julie, it's no surprise that social media has an impact on teens and children. While some say it can be beneficial, the U.S. Surgeon General's advisory is now weighing the dangers.
So for my day-to-day work, I spend a lot of time in what's called partial hospital, spending the day with teenagers and young people.
Dr. Joshua Stein is a child and adolescent psychiatrist with Prairie Care. He's used to helping young people navigate through mental health concerns, including the effects of social media on children and teens.
Really in the last 10 to 15 years, but more so in the last 5 years, even in my intakes, when I'm working with young people as a physician, we're talking about digital health.
And according to an advisory released today by the U.S. Surgeon General's office, social media use among young people is nearly universal, with up to 95% of teenagers and 40% of children aged 8 to 12 on apps.
What the Surgeon General came out with is some really significant evidence that greater than 3 hours a day is concerning.
But despite this widespread use among young people, the study shows there's still not enough evidence to determine if social media use is safe.
I think two themes come up over and over again from young people. One is the overt danger of being preyed upon, of being misled. The other side of it is a little bit more insidious, but it's the constant exposure to people having fun or people providing their best selves, the normalization of a lot of at-risk behaviors.
Dr. Stein says while there are pros and cons, when it comes to what's driving the growing concerns.
While there are some really strong benefits of social media, like shared experience, there's a lot of detriment to it. And so I see this as something that we're starting to talk about more.
Now, according to the advisory, parents can be more proactive by establishing tech-free zones, fostering more in-person relationships, and reporting concerning conduct online. For the full advisory, visit KARE11.com. Back to you.
All right. Thanks, Charmaine.